Hi, my name is Dr. Ross Hauser. Welcome to Caring Medical here in Fort Myers, Florida. We're in the studio at the Hauser Neck Center. And just excited about today's interview with Anna, who, like a lot of you, has had so many symptoms. And you were actually involved in living a healthy lifestyle, right? So it was, because, the question is always, somebody eats right, tries to be a positive person. And, you get frustrated when you see a whole bunch of doctors and different things. So tell us your story, like what were the main symptoms and what led you here and how are you doing?
So I got my Ehlers-Danlos diagnosis about 2.5 years ago.
Yeah.
And it started in my hip and it just wouldn't stay in place. I mean, I went through being like in the best shape of my life, super healthy, hiking, and all of a sudden I couldn't walk and went through some PT and then it just kind of progressed. So it went from one hip to the other hip to my knees, ribs, shoulders, and then when it got to my neck is when I started having all the weird neuro symptoms that we couldn't quite figure out.
So you went from like totally functioning, great, healthy person to pretty disabled, over a year period, 3-year period? How?
It was really over that first year.
Yeah, so in a 1-year period.
Man, did a couple different PT things, or saw a couple different physical therapists, and I just kind of it wasn't helping. I mean, it helped a little bit, but it wasn't enough. And I think I told you before I did the Muldowney protocol and committed over a year of my life to getting through that book. And
it helped.
It helped to an extent, but all the neck stuff and all the neuro symptoms that went along with it just kept getting progressively worse.
So explain, your vision issues and all the different things.
So I was having like retained image issues, double vision, blurred vision, kept seeing like I would have blind spots or little like flares that I would see. I mean, the headaches were unbearable. I've had migraines since I was a child, but they were nothing compared to this. And I mean, you're the one who diagnosed me with intracranial hypertension.
I know, but explain that though. Explain, because how did you know the things were different? So what was a migraine like that you normally would have, and how often would you get them, and how is this pressure different, like in your head?
So the migraines that I would get, I would lose vision and usually part of both eyes, but it would go away within 30 minutes. I'd take an NSAID, drink a cup of coffee or a soda that had caffeine, and they would resolve when I was younger. But with this, I mean, it felt like all the weird visual stuff, but also like someone was stabbing me in the back of my head through my eyes with a hot knife. The only thing I could do was just lay on the ground. I mean, I spent so much time just unable to do much of anything, just laying on the floor on my yoga mat and unable to be present in my life, be present in my children's life, my husband's life.
How long would those episodes last?
I mean, constantly.
Okay.
There were times where it would be a little bit better, but it never really went away until I started getting the injections in my neck.
For people who don't know what retained image is how would you describe it?
So I would look at something and then I would look away and I would still see it was like that image on top of the other image. Right. It was really bizarre. Yeah. And I remember tile floors were it was like confusing to me. And I even fell a couple times actually. We had this bathroom that had black and white tile floors and it would look like it was dancing.
Okay.
And just really unsteady on my feet.
Then what led you here then?
So I started getting prolotherapy injections in Tennessee, where we were from, before we moved to Orlando. And I started watching your videos, and then when realized you were in Fort Myers, only 3 hours away from Orlando.
Yeah.
I told my husband, I was like, when we move here, I'm going to see Dr. Hauser. This is where I'm going. I'm going to get my neck treated and figure out what's going on.
When you were getting prolotherapy before, was it all the body parts or?
I just had 3 sessions on my ribs, and then I had 2 on like my SI and both hips and coccyx and lumbar.
Was it already starting to help?
Absolutely.
Okay, yeah. See, a lot of people don't realize their migraines, the problem causing the migraines could be progressing even though it's under control because the person's using medications. And then over time you realize, I can't do this, I can't do that, or I'm going to get a migraine. And that's not really a good way to live, because whatever the issue is causing the migraines or the headache, it could be causing other things. Like if you knew that early on you had ligament problems, right? Because if you have EDS, it means when you were a kid, you had, you had, and when you're younger, sometimes. Well, let me ask you this: when you were younger, when you were a kid, did you do athletics or you didn't do athletics?
Yeah, I did soccer and swim team.
Okay. And beside the migraines, you didn't have any other symptoms?
I actually hyperextended my knee a couple times and popped it out of place.
But no neurologic things? You never really got dizzy, you never?
No, actually, I did have some issues with dizziness. And I kind of wonder, I think we talked about this last time too, if I even really had migraines or if it's just always been there and was misdiagnosed.
Yeah, you could have had ligament issues then, having muscle tension, and that, of course, could give you headaches. The vertebral artery and the C1 nerve, they kind of follow the same pathway. And so if you have upper cervical instability, it can stretch, compress the C1 nerve, and that can give you pain around your eyes or that. Because, you would probably agree, the horrible pain, there did seem to be a nerve component.
Absolutely.
Because you said it's when pain is like unbearable, there's some kind of nerve component. Then you got to just use Hauser's law, which means that if you follow the neurology leads to ligamentous joint instability. So if it's up here, it's going to lead to ligamentous joint instability in the neck. Do you remember when you were younger that you had tension in your neck?
Actually, yeah. I remember there were a few times I'd turn my head too fast and it would be in spasm for like days afterwards. And again, it's, hindsight's 20/20, obviously.
Yeah.
So.
Well, I just say that because people will come to me, I don't know what I did, I was doing fine. When I really nitpick them question-wise, they were having a decent life, but the problem was there. It was like smoldering. And you would, like, in other words, if I saw you when you were a teenager and you knew the future was going to be that awful year or 2 or 3 years, the awful years you had, you probably would have said, absolutely try to resolve this now because I don't want to go through. And then if you wouldn't have seen us, right, it would have been bad, right? It was really bad.
No, it was,
like really bad.
I had no quality of life. It was miserable. And even
because people would see you now, like you're smiling, pretty, nicely dressed, like happy. No, but you know what I mean, happy. But when you first came, man, it was bad.
No,
really bad.
And I've only had, this is going to be the 4th treatment on my neck.
It's only you. So basically, it was only like probably less than 4 months ago, or around 4 months ago. So you went from like awful to looking at you now, that's why we wanted to do this video.
And I feel like I'm getting my quality of life back. Even my kids say it, my husband says it, and and I feel like I'm getting myself back for the first time in a really long time. And I know I've still got some issues with the pop-in and instability, but the neuro symptoms have mostly resolved.
Okay, so go through system by system with your neural system. So let's talk first about your eyes, and then just tell us how each symptom's doing. So how's your vision?
I'm fine. I haven't had any issues with weird visual changes in months.
So the retained images, the blurry vision, the double vision, the after images.
All gone.
They're all gone. Okay. And then tell us other neural symptoms that you had.
Occasional headaches, still not nearly as often as they were, not constant.
And they're easily controllable by...
I just lay on my dinner roll that you gave me.
Okay. And that's fine. So you don't even need medications. So that's almost gone. And palpitation, POTS.
Actually, my POTS symptoms are way better,
Yeah,
too.
That's what I thought. Yeah.
I'm back to... I actually even work out with a personal trainer now, so I'm working on, like, building a lot of muscle.
Great.
My stamina's back. I ride the recumbent bike. I do a lot of walking. I, go in the weight room. And
Great.
So
that's gonna make
it's like
you
night
happy.
and day.
And then stomach.
It's fine. I don't really have a lot. I never really had a lot of GI issues. I would have some nausea.
Okay.
But not a lot of the other
Okay.
a lot of the other symptoms. But I'll get nauseous occasionally still, but not like I did.
Lightheaded, dizzy?
Not often.
Did you have it before? Mm-hmm. Bad, not so bad?
There were several days where it was, again, I just spit on my floor because I was too
stuff
too weak
spinning
to even get
or
up. Yeah.
Okay. You had vertigo or no?
Occasionally, but
Okay.
I mean, I was diagnosed with POTS when I was,
Okay.
I think, like 19.
I gotcha. Okay. And then ringing of the ears? Mm-hmm. Okay.
Nothing.
Okay, did you have some before?
Mm-hmm. Occasionally. And I
Okay.
remember you asking, too, if I could hear my own heartbeat. And that was when I was like, wait, not everyone does that?
Okay. And did that go away? Mm-hmm. So you had a little bit of pulsatile tinnitus, so that's all gone. And then probably your memory or your cognitive ability or your...
the brain fog, yes.
Yeah, so tell us about that.
I felt like I couldn't hold on to a thought very well. I would constantly lose my train of thought, like, be in the middle of a sentence and just totally forget what I was talking about. I felt like I had a lot of memory issues as well, like, just forming things from short-term into long-term memory. And I feel much more clear-headed
Okay.
for the first time in, a really long time.
No, that's awesome. Did you see a lot of people before you came here? Like, did you see a neurologist? Did you see...
I never saw a neurologist.
Okay.
I saw a cardiologist before and was told that I just had POTS, and that was it.
And there wasn't really much they could do or give you a beta blocker or something?
No, and I had several physicians that kind of just insinuated a lot of this stuff was in my head.
Okay.
Not my neck, as we know now.
Did you get depressed, like a little bit, like when they started saying that, or?
Definitely, and I knew something was wrong, and my husband could tell something was wrong too. And he's a pediatric neurologist, so he sees, neurology is a specialty, and he could see that I was deteriorating quickly. And
Was he
concerning.
supportive, like when you said you're gonna? Well, when you first were doing prolotherapy in Tennessee, was he supportive?
Oh, 100%.
Okay.
Mm-hmm.
So when you were gonna come down here, he...
Totally on board.
Okay.
He was, he was in agreement with me. Like, if we're going to be this close, like, we're going to Hauser next.
Didn't you say to me? I think you said to me at the last visit that he's starting to look at the kids' necks too, or something.
Mm-hmm. Some of the headache patients and stuff. He's noticed. He'll even do like Baton testing on them, and
that's good.
Try to
look at their hypermobility. Mm-hmm. Oh, that's great.
Yeah, because if what we've always been told, if you can't figure out the cause, you can't connect the dots, think connective tissue. It kind of goes right hand in hand with Hauser's law, following the neurology.
Good. That's good. Yeah, that's really good. People forget kids have really little necks, right? They have these itsy bitsy necks and they got these huge heads. Like a 2-year-old, 3-year-old, 4-year-old. So it means that their ligaments actually are under more strain and especially if they're looking down at a cell phone. So, like, how parents, they entertain the kids with the tablets. Well, you can still use whatever you entertain them with, but just have them look up at a TV.
We even got prism glasses for them as well.
How old are they?
They're 8 and 5.
Are they okay with using them?
It's a work in progress.
Okay.
The 8-year-old keeps them on better than the 5-year-olds.
Okay.
But
were they starting to get where they're addicted to the cell phone?
Oh, for sure.
Okay.
I mean, we pull them away. We do a whole lot of, like, especially now that I'm feeling better, we love getting out in the city and exploring new things. On the weekends when we're off, we don't want to just be sitting around all day looking at electronics. We want to move and...
Yeah, good. Let's just talk about, you see us, then obviously we educated you on sleep this way, use prism glasses. So how do you live your life differently now than you did prior to coming? Like, what things, just for the people that might watch this, what are things that you do?
So I work from home.
Okay.
And I've always had a standing desk.
Yeah. So what kind of work do you do?
So I'm a nurse, but so my background's in ICU, but I do chart review stuff now, which is perfect for EDS.
Yeah.
So I have a standing desk that I even elevate my screen even higher. So
that's what I have
lifestyle.
too.
Yeah, I see that.
Yeah.
I've
Okay.
got puzzle boxes, not books under my
So you're definitely trying to use your muscles while you work.
Yeah, but even when I'm doing things around the house,
Okay.
like if I'm, washing dishes, I have my prism glasses on, or like chopping vegetables for us to cook, I've got my prism glasses on. And I guess just trying to maintain, like sleeping on my left side is my jugular vein almost completely was occluded. Like it was down to nothing from what you guys told me. So I try to avoid that.
Okay.
Although sometimes I'll wake up and I'll be on my left side and then I'll have a headache and it's like, well, this is what happens.
No, that's good to know, just to know. What position closes off your jugular vein and which one
So
opens
sleeping
it?
on my left side and then turning my head to the left and looking down.
That's bad.
Yeah.
Okay.
I am curious for my neck vitals for the next visit, though, to see how.
Did you get them today or the next time?
No, it's going to be the next time.
Okay. And I guess you referred your sister on.
So,
Is she loose jointed too?
oh, yeah, we both have EDS.
Okay.
So you're seeing her today after I get my neck injections.
Okay. Thank you for the referral.
Absolutely. Well, I want her, before she starts having all the neuro symptoms I'm having,
Okay.
I'd rather her get seen now before it gets worse.
Yeah.
And I mean,
So she understands that. Are you guys close?
oh, absolutely.
Okay, good. Ligamentous joint instability is a progressive disorder. You have a loose hinge on a cabinet door, one screw's loose. Well, then the force goes to the other screw, then the hinge gets loose. And in the human body, if this hinge gets loose, your knee gets loose, and you don't do anything about it, it means that when you're walking, this bone's moving too much, that bone's moving too much. That's why then your ankle hurts, your hip hurts, then eventually the perineal nerve will start getting hit. So you actually have to do something about it. You can't just ignore it.
No.
So I think that's what a lot of people do. Well, and again, your case, you didn't know any better, but even just something as simple as headaches, you have to get at the root cause of the headache. Like, don't just keep having headaches, or I got a little bit of neck tension, or I got...
And with these headaches, I mean, medication wouldn't even touch it.
Yeah.
I was just miserable. I was light sensitive. I was noise sensitive, which with two rambunctious little boys, you can imagine there's a lot of noise in our house.
Yeah, exactly. Now, do you have us looking at the other body parts, or they're all fine?
No, it's...
So explain. So you see Danielle.
So I'm seeing Danielle right now. Yesterday I got my chest and thoracic area treated, and the time before we had my shoulders also, but my shoulders have stabilized, so I didn't need my shoulders yesterday.
Yeah.
And then I'll get my neck with you today, and she thinks probably 1 or 2 more treatments here, and then we'll start going to the lumbar spine.
Well, what symptoms was the chest and the thoracic causing? With real bad pain?
Oh, I have so much pain and clicking. It's that like first and second rib, and my clavicles just popping out. Lots of shoulder pain, neck pain. Okay. And then, lots of hip issues as well. I mean, just...
Well, even pain, because you know how it is, like pain relievers are like probably the number one drug people take is Tylenol and aspirin and NSAIDs plus all the prescription. And it's amazing how many people have died from a fentanyl overdose. I didn't realize, like I just saw a podcast, it's hundreds of thousands of Americans. I guess my point is that because some people do get addicted to fentanyl because of pain. Like obviously some people use it just for a high, but chronic pain is a serious, serious disorder. It's not, because we think, oh, I got a little bit of pain, but the pain is telling your body there's a problem. So God made the human body that way so you would do something about it. And it's not wrong. Once a year or twice a year I get a headache, so I'll pop. It's almost like it's so psychologically, I just know the aspirin's going to help me. So it's amazing. Like, so there's nothing wrong with occasionally using ibuprofen, like a woman's got menstrual cramps. But, there's a reason why you got menstrual cramps. So you should really try to address the cause. No,
I try pretty much any kind of non-pharmacological approach before I do anything. And like I meditate every day. I know I told you that.
Oh, that's good.
That's kind of my go-to when I'm...
So explain what that is. Like, what do you do exactly?
So I used to be able to sit up straighter for longer. Now I just get my yoga mat out and I just lay on my back and do it and just practice deep breathing. I do Usually inhale for a count of 5, hold for a count of 10, exhale for a count of 5, hold for a count of 10.
Wow.
And every day, that's kind of my go-to.
Wow.
Is
5 minutes, or how long do you do it?
Usually about a half hour.
Gosh, wow, that's amazing.
It's I've been doing it for so long now, but when
it makes you feel better,
it
like
does.
You feel so much better, calmer.
And then if I'm having a really acute episode of pain, then that's my first go-to.
Okay.
It's we have this saying in our house. It's down to ground. So when you start either like feeling like you're getting, going into like fight or flight mode, because that always happens if you're hurting, and then noise sensitive, light sensitive, everything else. Down to ground is what we say. So I just lay on the ground and try to take a few minutes of just quiet, deep breathing, and can realign a little better.
Hey, we're so happy for you.
Thanks.
Happy
to be here.
Thank you for making this video.
Absolutely. I feel like if we can, the more people that know about it, if it can make a difference and help anyone else go through, or not have to go through what I went through, or not let it get as bad as it did for me before you get treated,
Thank
get seen.
No, thank you.
Absolutely.